All right. So, hello everyone. Thank you for being here. Our webinar today on climate grief is intimately intertwined with the challenges that are faced by the Indigenous people here on Turtle Island. Many of us are spread out over what is now called Canada. This has been the traditional land to many First Nations, Métis, and Inuit people who lived in harmony with the earth, plants, animals, and fungi for thousands of years. I am currently located on the traditional lands of the Lekwungen and Wasanic peoples. When the land was ceded via the Douglas treaties, it was with the understanding that the settlers would keep to themselves and not disrupt the way of life of the Indigenous peoples. However, the people and other beings that traditionally lived here have had their way of life severely threatened. There are still many First Nations, Métis, and Inuit who live on this land, but many of them do so without their basic human rights respected and continue to reel from the genocide inflicted upon their people. As we talk about our climate, let us bear in mind that ending the harms to Indigenous peoples and engaging in a process of reconciliation is a fundamental necessity to healing the challenges that are inherent to the climate crisis. So my name is Autumn Sipis. I am the Marketing and Outreach Coordinator with the Canadian Coalition for Green Healthcare. And on behalf of the Coalition and Peach Health Ontario, I would like to welcome you to today's webinar, Creating Space and Healing Climate Emotions for Planetary Health. Throughout the webinar, please use the chat function for any technical issues you may be experiencing. Use the Q&A function for any questions you have regarding the presentation, and our panelists will be answering questions at the end of our webinar today. We are also recording this webinar, which will be sent to all registrants and will be available on our website and YouTube channel at a later time. To start off the webinar today, I would like to invite Dr. Anna Gunz, a pediatrician and the clinical lead for planetary health and sustainability at Children's Hospital London Health Sciences Centre, to introduce today's topic and speakers. Take it away, Anna.
Thank you, Autumn. It's wonderful to be here today, and I'm really glad that the Coalition for Green Healthcare is having this conversation. And I love the title as well, which is Climate Emotions, because I think going back to land acknowledgement too, one of my biggest teachers that I am very fortunate to have in my life, who is a Mohawk healer as well as a profoundly wise person, will often talk about taking care of yourself before you take care of her. And that's how he introduced the climate conference that we had last week when he gave an opening. Bill Hill, but a lot of the knowledge and experience, and even in terms of coping through this space, there's a lot of parallels between any other really huge problem and chronic stress, anyone in social justice dealing with truth and reconciliation. There are a lot of emotions that we have to deal with, and a lot of conversations about how to continue to have conversations, how to hold different emotions, how to cultivate hope and the importance of that, yet sometimes feeling despair. So I hold all the teachings that I've had close to my heart, and I think I want to acknowledge those parallels, because there are some criticisms in the space when we talk about eco-distress and the number of different terms that can be used and help us categorize some of the emotions that we feel. That it is sort of a colonial problem, and where people have been dealing with this huge issues of devaluation of self and culture, and how someone's life expectancy and well-being and value could be changed based on who you are. So I think we should put that that wisdom and knowledge into context in terms of how we deal with this chronic burden. I think the other piece that I'll do just before we introduce this is, I think that there are direct effects to our mental health and mental illness that can be cultivated from direct effects from climate change and even the environment, including different environmental toxicants that can affect people's well-being. The space that we're talking about here is more to do with this awareness and knowledge and the loss and grief that we feel as we start to understand the way that the world, the climate, has changed and is continuing to change, and dealing with such a big system transformation that we have to lead with in this endurance. And so I think it's really important that we separate the concept of mental illness and mental health. You can have mental illness bipolar disorder, schizophrenia, and have good mental health. And at the same time, too, you can have poor mental health with these burdens of emotions, and that doesn't necessarily translate to mental illness. And I think one of the things that we see as pediatrician and my friends in pediatric psychiatry is dealing with how you take this really real concern and anxiety that's very true, and when people actually are to the point where then they have mental illness that this is contributing to, because a lot of the treatment thus far for anxiety is about putting these worries in context and proportion, and making them proportionate to experience, which isn't actually the reality here. So this is where I'm really excited about this panel, where people actually, from our panelists who have solutions and programs to support people through this, because it is, really complicated and important, but we have to sort of keep these elements in mind. So with that, though, with Bill's words, taking care of self before others, I think being true to practice, I invite you all, let's start with a mindfulness practice so that we can ground ourselves in the moment, in our breath, in our feelings right now, and acknowledge them. So I'm going to do we're going to take 5 breaths together. I'll lead us through a mindfulness practice. Feel free to close your eyes or take a fixed point before you. But afterwards, I'm going to ask, and I hope we have access to a chat. If you don't, maybe we could use the Q&A. But if you have access to the chat, is that after this, I'll ask you for one word of how you're feeling, and I'll cue you for it if you type it in, and then we can do a bit of a waterfall where we can see those feelings if you feel comfortable doing that. But if you don't, that's fine. So just to take a moment for yourself. So sit in a comfortable position wherever you are. And you can close your eyes or concentrate on a fixed point in front of you. And take a moment to center yourself in your spot. Sit up tall with your back straight and tall, like the trunk of a tree. And you place your feet on the ground below you and feel roots growing from your feet into the earth that connect you to each other, but also to your home, whether that's somewhere in your heart or the ground that's beneath you now. Just focus your attention on your breath. You don't have to do anything different. You know how to breathe. And I invite you just to take 5 breaths to yourself. And you can, every time you take a new breath in, breathe in hope and possibility and the connection that we have with each other right now. And as you breathe out, it's a moment to release anything that you're holding on to that is weighing you down, or you don't need to carry with you right now. And if your mind wanders, that's fine. Acknowledge that and just refocus on your breath. And when you're ready, you can open your eyes or readjust, blink your eyes open. And I invite you to give one word in the chat about how you're feeling at this moment. Feel free to enter that. As that happens, I'm going to introduce our first speaker. So I'm really delighted to introduce Dr. Nate Charach, who is a psychiatrist working in Toronto. Over the last year, he's developed psychiatry groups, a branch of mental health treatment to foster climate empowerment. They integrate concepts from Joanna Macy's work that reconnects with his psychotherapeutic skills. He studied at the Earthship Academy, completed a permaculture design certificate, and is growing an edible forest garden in his backyard. He's also a founding member and current chair of the board of directors of the Bunchberry Connections, a nonprofit whose focus is to grow mental health through nature connections, through nature connected communities. Thank you for this. And I will, as he turns on turns on his PowerPoint, shares the screen, I invite you to look at the chat and feel how your co-facilitator or everyone around you is feeling. And I'm going to add the word grounded as well. And Dr. Charach, we would love to hear your word.
Thank you, Anna. In terms of this branch of psychiatry that I've started, I spell it with a tree at the end of it because I'm trying to connect mental health with nature. We know there's a lot of benefits that come from really nature connection, and in doing it with a thinking of the spirit of how do we heal the world that we're in right now. Today we're talking about creating the space for healing climate emotions for planetary health. And I think that the emotions are actually not just about the climate. As Anna mentioned, when we frame it in terms of the climate crisis, it might be less inclusive than when we think about if you could mute, somebody needs to mute. So when we think about emotions, it's the way that we relate to our emotions that I think fundamentally is really important and what has brought me to this work. In thinking about my disclosures for today, I'm speaking from a place where I depend on the earth and the web of life for my survival. So I have a bias towards thinking about how do we, as a culture, shift what we're doing to fundamentally be relating differently to one another and to all of the other beings, both living and perhaps not living on this planet. And in terms of understanding how I've come into this work, I think it's important that I share with you a little bit about my journey. So, I'm a psychiatrist, and during my residency, I trained a lot in group therapies. So I have a really deep sense of understanding of how important feeling a part of community and belonging can be in terms of our mental health, and how the breakdown of our communities is a major part of what affects people's mental health. And in parallel, I've been concerned about the climate crisis for quite a while now, and have done various different kinds of trying to understand what we need to be doing differently to shift our society in a direction that is in keeping with what the world wants us to do. And on this journey, I did the permaculture design course, and permaculture, for those who aren't familiar with it, is about how do we build systems that align with what nature wants us to do. And in this course, I was invited to do a meditation where the facilitator was talking about how it's not just about the outer permaculture and the structures that we design, but it's also about the inner permaculture. And that if we actually don't shift our inner permaculture, we aren't going to design systems that work. And we can see this as evidenced by our shift from gas cars to electric cars. We've just shifted the problem. Or when we think about trying to do carbon capture that doesn't actually fundamentally shift things, if we're not actually addressing changing what we're doing fundamentally in terms of our relationship with the world, we're just moving the problem to a different part of the place. And so in this exercise, I was aware of a great pain in my chest that I've experienced at other points, but didn't realize that this was a pain that actually came from grief. And in sitting with that grief, I actually was able to have tears flow, and they weren't sort of terrifying tears. They were tears that were really calming. And this was my first sort of embodied understanding of what it means to radically accept what we need to change. And it helped me to then shift my psychiatric practice as well, in terms of recognizing that we need to stop trying to avoid our emotions and actually really engage with them in a fundamentally different way, where we don't fear our helplessness or our hopelessness or our grief, that instead we actually learn to listen to them in a way that can be much more healing. And so this was a major turning point for me, and actually allowed me to then be open to some of the work that I'm going to talk about today, that has helped me to heal in a very different kind of way that I've found to be much more helpful. And I think it's important to know it helps both with mental health and with mental disorders. I think a lot of the underlying processes are fundamentally the same, that we're relating in an unhealthy way to our emotions, and that for some people it just comes out in different kinds of ways than for others. In terms of what I'm hoping you'll take away from today, I'm going to share with you a framework that helps to transform grief into healing, and I hope that you'll also be able to distinguish the difference between passive and active hope. So there's a variety of climate emotions that I find people are trying to avoid, and it comes up with the climate distress, but it also comes up in the face of, when we think about maybe our healthcare system collapsing under the weight of COVID, it comes up under some of the emotions that come up with the war that's happening in the Middle East, the war that's happening in Ukraine. There are a lot of things that are happening on a level that is bigger than our individual lives, that can bring up fear, anxiety, sadness, grief, despair, anger and frustration. There can be isolation and loneliness when we don't feel connected to others in these emotions. There can be hopelessness when we feel that there's no way that these things are going to resolve, and helplessness when we don't understand how we can have any power in changing these things. And all of these emotions are absolutely normal. And the challenge is about how do we interpret them in a way that is actually healthy, rather than act on them in ways that becomes unhealthy. And I think that this is where our society in general doesn't actually have a helpful framework for how to react and internalize these emotions and process them in a healthy way. And so I came about to the work that I'm doing right now directly through a book called Active Hope, which is co-authored by Joanna Macy and Chris Johnstone. Joanna Macy has a background that is both from a Buddhist lens as well as a systems theory lens, and she merged these two backgrounds into what she called the work that reconnects. And she collaborated with Chris Johnstone for this book, and he was a physician. He still is a physician who worked with people in addictions, and he found that this work was very healing for them as well. And I also found that there is an element in this kind of work that was missing for me in the traditional mental health therapies that I had been involved with, and that's why I have brought this in. I'm currently using my mental health expertise that I've been trained in, while also combining it with this framework, because I think it is very useful. And it starts with talking about the importance of narrative. Often we are in sort of, our culture has been in a business as usual mode, telling us to continue what we're doing, that economic growth is more important than anything else. It allows us to commodify nature and also one another, that the more we produce, the more valuable we are. And this model can kind of work well enough. We can kind of, there's a climate issue out there, there's a war issue out there. We can kind of put those on the back burner, but it only works until disaster strikes us. And then we often shift into a frame of the great unraveling, where ecosystems are collapsing, species are going extinct, lots of people, innocent people, are dying, and it just feels like the healthcare system is falling apart. Everything is unraveling, and this is a terrifying place to be in. We don't have the skills to know what to do differently, and so sometimes we shift back into business as usual, and we move back and forth between this very unpleasant place. But this work invites us to be part of a story of what's called the Great Turning, which is a story that helps to see that we've been living in this society that values economic growth, and that if humans are going to make it, we need to be shifting into a society that values life above everything else. And so if that's the case, how do we become part of that shift? And this is how we can actually engage in this in a way that feels safe. There's 3 dimensions to the Great Turning coming. So one of them is about holding actions. This is campaigns that are in defense of life on Earth. In Ontario, where I'm currently residing, we've recently seen an example of this with the Green Belt, where the government was planning to let protected area go to developers there was a major uprising amongst the people, and we have managed to hold off that development and keep this area protected for at least for now. And these are incredibly important holding actions, but in and of themselves are not enough. We also need to be having a shift in consciousness, which includes changing in the way that we're thinking, what we're valuing, and how we are reacting to our emotions becomes a part of this as well. And then translating this into life-sustaining systems and practices, which means developing new economic and social structures which value life rather than economic growth as its fundamental basis. And so with this, we come to approach our emotions from a spiral of what's called the work that reconnects. And it's a spiral because this work is never finished. We're going to keep having emotions. We're going to keep engaging with this. And we're not going to ever actually be back to where we started, which would be a circle. So when we come back to the start again, we're in a slightly different place, which is why this becomes a spiral. And so we start from a place of gratitude. It's where the roots of everything is, because that's what allows us to feel safe. But once we have felt safe, we move into being able to honor our pain, which means engaging with some of these difficult emotions. We then are able to see things from new perspectives, which allows us to go forth and bring this into the world. And so briefly, gratitude can seem counterintuitive when we're in a place of being distressed. But the reason that we start there is because we can always find something, whether it's something very small, that we can be grateful for. And it allows us to be able to access this place of well-being, no matter what our circumstances are around right now. And it allows us to foster trust and generosity between one another, and also between ourselves and the earth, and so can motivate us to act for our world in general. Gaia theory essentially is a scientific theory which posits that the world is actually like a living organism, because it regulates its oxygen levels, it regulates its temperature, it regulates the salinity in the oceans. And so it does all these things to keep itself within homeostasis, like all living organisms do. And when we think about it in this way, we might relate slightly different to it. And then once we feel a bit of groundedness and sense of safety, we then can take the step of honoring our pain. And this is where we can engage with the sadness, the grief, the hopelessness, the helplessness, and really learn to listen to these emotions carefully. Very often we are trying to push these emotions away, whether it's through distraction techniques or ways to sort of make ourselves talk ourselves out of the emotions. These are the two predominant ways that people in our culture are often responding to emotions. And this way is inviting us to say, no, pain is actually healthy and widespread because of where the earth is at right now. And because of where so many of our relationships are at and where things are at, it is absolutely acceptable and normal to feel this. And when we listen to it, we actually get an appropriate feedback loop that's reinstated. So if we are not treating the earth well, it would make sense that we get messages that tell us that we need to be doing something differently. And that message may come in the form of pain. And if we're not listening to it, we're not going to pay attention to it, and we're not going to shift what we do. And also, I mean, in psychotherapy, we call this catharsis. But when we allow ourselves to feel stuff that we've been holding back, we actually get a release of energy. And it feels much better to no longer feel we have to repress it or depress it and push it down and then feel depressed as a result, or try to avoid it and then feel anxious as a result. And instead, we can actually just acknowledge what is here, which really frees us up. And finally, when we recognize that humans, as much as we try to treat us like we're rational creatures, information doesn't motivate us to make changes. We need to be tapped into our emotions, and it's through connecting with our emotions that real change comes about. So that then brings us to seeing with new eyes. I'm not going to go into all of this in detail, but there's different perspectives that come in with the work in terms of how we view ourselves, how we can gain more in terms of our community, how we can engage with power with one another rather than power over one another, and how when we view things in terms of a larger view of time, this can also be very helpful also. And then we bring this wisdom with us in going forth in terms of trying to capture an inspiring vision for others and being willing to believe that things that may not yet seem possible are actually possible is a risk that is required of us. And then we learn how to build support around us and how to be strengthened by uncertainty. In fact, right now, if we were certain of anything, the climate science is that we are certainly doomed. And so uncertainty actually gives us the chance that maybe we can find a way to shift things. And so lastly, I just want to touch on the difference between passive and active hope. Passive hope is when we are hoping that others are going to make the changes for us that we need. We're hoping that governments institute policies, that corporations clean up their act. And we feel helpless in this because we're giving all of the power to do everything and just hoping. And this is where hopelessness often comes from. Either we're not doing enough, or we're actually trying to do everything, and that also will make us feel hopeless. Active hope, on the other hand, is this flower here is displaying active hope. It's saying, I can't fix everything on my own, but I'm going to do what is within my influence to try to make the difference that I can make here. And by choosing to plant itself in the middle of this concrete, it adds a little bit of beauty, and it has ripple effects by creating other cracks in the concrete that other seeds can now find their way in to collaborate together. And so active hope starts with, we don't have any assurance that things are going to work out the way we want them to. And yet we also know that if we do our part, there's a better chance of things working out than if we don't. So I will wrap up my time here for now. Thank you all for attention, and we'll pass it over to Anna to introduce Kady.
Thank you. That was wonderful. And as Kate, I introduced Kate, I think there's two concepts that I took from your talk. And one of them is really, I think you're talking about kind of not only decolonizing our world, but also our minds in terms of, the wisdom that comes from that, leaning into not fearing our negative emotions, that power with one another, not over one another. And these cycles of life, death, life, and the teachings that come around that, that come from it. I think the second piece is active, right? We think of eating and exercise as active things, but gratitude, rest, self-compassion, and hope are all active things that we need to work for. So we need to make space in our lives and days. Are two themes that I took from that. And I don't know if that was intentional, but I definitely appreciate what you're saying. Our second speaker is Kady Cowan. She's the founder of the Sustainability Studio, where she invites organizations and institutes to collaborate where they have time to learn and practice, combining sustainability, environmental protection, climate safety, and a holistic ecosystem perspective into both strategic and everyday activities of work. She's connected with a number of organizations such as the Canadian Coalition of Green Healthcare, Doctors Without Borders, Independent Electricity System Operators in Ontario, Atrium Health in North Carolina, and University Health Network in Toronto. So I'm really excited to listen to you, Kady.
Thank you so much. Great pleasure to be here to follow on this topic, which is so important to me personally, and that the institutions that we love and respect are starting to take this topic seriously as well, and supporting us as practitioners who've been in the weeds for some time now. I hope that everybody can see my screen. I guess somebody will tell me if you can't. And I'm just going to roll through a bit of a story around the Climate TikTok Circle, which is a process, a gathering that I have been convening for about 4 years, just off the side of my desk. And I'll tell you a little bit about why and what's been going on with it. So I'll be covering just how it started, what the experience has been, and some of my observations as circle keeper, which is what I call myself. So I am an environmental activist and a sustainability practitioner. I work at the intersection of climate, environment, health, and ecosystems. I've been doing it for over 20 years. actively and productively, and in some cases successfully. And I came to realize at some point that in many of the meetings that I was hosting and attending, there was a lot of discomfort. There was a lot of movements in seats. There was a lot of arm folding. And I was interpreting that as a lot of reluctance and resistance to what I was bringing to the table around what to me felt like climate realities, environmental realities around degradation, lack of protection. And from my perspective, I thought we were coming to have a talk about what we could do. What we could do as institutions. But what I came to realize was that nobody could hear that, because they got stuck on the fear and the many other emotions that go with fear in these conversations. And I started to connect that to a heaviness in my own day-to-day life. I felt it in my back and in my shoulders and around my neck, as a weight, as a physical weight. And it seemed to be persistent, and it seemed to be chronic. And I was able to sort of connect that feeling to what I called at the time ecological anxiety. That was sort of the word of the day, still used. I've learned from Nate the terminology ecological distress, which I think is more appropriate for me. And as I started to sort of connect these things in my own life, I realized that the people that I work with and for and through and beside might possibly also be thinking and feeling something similar. However, it had never been discussed or raised. Even with close colleagues and friends, how we felt about our work, how we felt about moving forward with these concepts and projects and policies and activism and influence and advocacy. We never talked about how we as individuals felt. And so I gathered together a group to do just that, to not talk about what we do, but to talk about how we feel. And to bear what we know, because often we bring bad news if you look at things as they are. And so I wanted to find a way that we could express this as in a peer-to-peer model, where there was no orientation towards solution, and there was no orientation towards action. The work that I've been leading through the Climate TikTok Circle has been dominantly focused on climate and environment workers, so people that do this day to day in their life and have not just recently come into climate awareness, but have committed potentially decades to the topic. So I started in January 2020 live, and that ended immediately, and we went online. And it became a global network, which has been fascinating and wonderful. And the format it takes is what I try to strive for is accessible and safe spaces for exploring emotional reactions. So people come to the circle as they are. There's no prep or intention to provide any sort of solution or advice to what's happening to people, but to hold their experiences and their feelings in a container together. There is a process that I have developed over time to make that container accessible and safe. But anybody who shows up at our circle has the opportunity to help define what the circle is. And that does happen pretty regularly, especially as we draw from a global pool of people who are ready to face their climate feelings. So it's 100% peer-to-peer. None of us are clinicians. A lot of us are scientists and engineers and policy people, activists, students, researchers, people who are embedded in the topic of environment and climate. And don't have any expertise or really connection to healthcare treatment or service or clinical perspectives at all. And so that's something that I think that's really unique about what we've been able to accomplish in the Climate TikTok Circle. It is online for now, and I am still trying to figure out how to bring it back live here in the city of Toronto, where I am. And it's all word of mouth. So there's no institutional backing for this at all. It's just through social media, through newsletters, through people tapping each other on the shoulder and saying that this exists and you can come. It's free. There's no fee to join us. And I just want to say that it's about 99% women who have attended the circle in the almost 4 years that I have been doing it. And I think it's a fairly important point to keep in mind in that women's health in general has been second fiddle to a lot of other health issues collectively, and this one is now echoing that. So I think it's important that we maybe stop and pause for a second around why women are experiencing this more publicly. I'm not saying that is that the experience is only for women, but in the public domain, and how we can help to meet some of those needs. It's just an observation of mine from the work. I use this value from Margaret Wheatley, who I consider one of the best inspirations around climate and activism and taking care of ourselves. She's been at the forefront of this for decades. And this is her quote: "Don't fix, don't flee, stay present." And that seems to be a guiding principle for the circle that we bring together. And it's actually a lot of work. So to do these three things simultaneously is quite difficult, especially for people who are trained in engineering and activism and topics where we're paid to constantly come up with solutions. To sit for 90 minutes and not come up with solutions and not provide advice actually takes some practice, and the circle is there to help people to practice that, to show up for each other in the moment as we are, as needed. I think that this is helping us to stay grounded in what is ours to do in a peer-to-peer model. So the way that the circle flows, I have developed an opening ritual and a closing ritual, or I bookend the circle with these two rituals. I'm more and more committed to the idea of new climate rituals, things that we need to do together to collectively face everything that's going around us. I believe that these rituals are lacking. And as we come together and more publicly acknowledge the realities, we can start to figure out what those rituals will be in situ, in context, for specific needs. So one way I've done that is through the ritual of the circle. It's usually acknowledgements of land, but also of climate impacts around the world. We always take a moment to think about that and bring that into our circle space. There's usually a reading or some sort of words from elsewhere that are brought in at the beginning, and then a noticing practice. So helping people to just show up for the moments that we have together. The middle of the circle is really open. I always have something prepared for the circle, whether that be some questions or prompts for people to consider, some practices of movement and embodiment and breath work when it's available to people. But like I said, anybody who comes to the circle can help define it. So we often go in different directions in this moment. And people are encouraged to speak in the first person. So really to be grounding their comments or their sharing from themselves. And then we close the circle together, usually with another grounding before we leave, and acknowledge that we are here for each other, and that this is a moment of restoration, and possibly reprieve from the day-to-day. We all have to get back to our day jobs and keep going with the work. And this is a moment for us to take almost like a timeout, so that we can be ready to do what we need to do, and then check out with a final word, just to make sure, just to check in to see how everybody's doing at the end of what is sometimes quite heavy and real experiences for people that they may not have been able to access on their own or within their own networks before. So that's the flow of the thing. So what I've been able to observe in our circle, I would say overall things work really well. I have been so happy to be able to do this for folks. I literally just made it up, and it seems to be developing and getting some traction, and providing some sanctuary for people to express how they're feeling on a topic that is more and more important, more and more dominant in popular and academic media, and so therefore harder to hide from. So I think we are meeting a need. I think the need is 100% there. I think that we're experimenting with rituals to help us survive, manage between moments of reprieve or rest. I think that there's a real acknowledgement that you're not alone, that there are other people feeling this as deeply, maybe more deeply, maybe less deeply than you, but certainly are here to understand whatever it is that you are experiencing. And we have this moment of temporary relief. So consider that all to be working really well. I think there's definitely limits to what's possible. It's all volunteer run. I do it once a month because that's sort of my capacity. It's hard to reach people. Word of mouth, it's not super easy. And because we're online, we don't have as much community building as I would hope to have, where people can lean on each other between circles. And it's hard work. I mean, it is definitely hard to do these things. And I notice that and feel that within my own circle, when people often say to me, thank you for doing this, but I'm never coming to your circle. I'm not going to face these feelings. And so we know that there are still some limits for being able to get people together. And I added temporary relief to this list as well, because I think it's, as much as it's a benefit to have some temporary relief, I think it's also a limit. We would definitely like more durable relief in ways that we can find it. Overall, I think we've had about 200 registrants, so people who've come through and just signed up. About half of those people have actually shown up at the circle. They're very small circles, to be honest, between 3 and 8 at each circle. I would say 3 is a minimum. Otherwise, it's more of a triangle if you include me. So it's important to have, at least 4 of us together. I'd love to have more. We have a circle coming up on November 21st online, so you can register for that if you'd like, and get the word out. And that is a little story about the Climate TikTok Circle. Thank you so much for the opportunity to share it with you.
Thank you, Kady. And I invite everyone, Nate as well, to turn your camera on for our Q&A. Thank you for sharing. I think it gives us a good embodiment of how you're actually creating a space for people to actively take a reprieve. And so I really appreciate that. And I think, though I challenge this concept of temporary relief, I think that's just realistic, right? I mean, there's difficult things that we face all the time in our lives. And as I try to teach my own children, like, it's okay. Or as we heard from Nate, like, it's okay to have bad feelings and feel sad. It's, acknowledging them and how we move forward. And I think that's also part of this culture that we live in, which is, I mean, I'm English, so you don't feel, right? And how that actually looks in process. And I find it fascinating as well that you said it's the majority of women, but doesn't surprise me in a way as well, which is interesting statement, I think, about the world that we're in now and the culture that, at least, the mainstream Western culture. So I really find that very interesting. Please, everyone, put questions in the Q&A. I see there's the question about how long they are, if they're 60 minutes, and then if you also have to have TikTok to access that.
Oh, yeah, no, they're 90-minute circles online. The live ones are 2 hours because we add a bit of social time. You do not need TikTok. It's a Zoom meeting. I just call it Climate TikTok as a play on words, right? Yeah.
And the all you can save circles. I'm glad someone brought up the climate cafes, because there's certainly a number of these different kind of community building approaches. And then there was a question about whether you have seen the all you can save circles as well.
Yes, lots of language out there around climate cafes, climate circles. I like the circle idea myself because of the supportiveness of it, the sort of, I don't know, that's just where I landed. But climate cafes are, I think, do a lot of important and critical work and maybe exactly the same as a circle. I think they might be interchangeable.
I have a question for Nate. You talk about the work that you're doing. Have you integrated this in your clinical practice with people who are coming to see you, who are at higher levels of distress? And have you integrated this into sort of other forms of the work that you do with the patients that you see?
Yeah, so I mean, for the first seven years of my work, I worked in community hospitals, and I had a very high volume of patients. And over, the thing that I actually found was a theme was that psychiatry likes to distinguish between different kinds of disorders, but there was always an underlying theme that there are emotions that people don't want to feel, and that was across everyone. And that if you address that, regardless of what the disorder was, people would get better. Like, you're not necessarily going to get some people off medications who need it, right? But people would improve in terms of their functioning, their well-being, and that was really clear to me. And I've actually shifted away from the hospital system. So the psychiatry that I'm doing now, I'm trying to develop it as my full-time work now. I mean, it's hard coordinating groups with schedules and so forth. So I'm still doing a little bit of more traditional psychiatry as I'm trying to get this going. But one of the things that I really felt was that I'm needed in this space. I understand how to help with people's motivation, but there's a lot of distress out there. We have an upcoming epidemic of climate distress coming. We know lots of people are already worried, and that after every climate disaster that hits, more people get worried. And so this is kind of like a sort of new field in a certain way, because people haven't been addressing it. But I'm also trying to help promote wellness before people get to a state of paralysis, because I think that's another mistake that we've made with mental health, is that we wait till somebody is totally paralyzed before we offer them help. And in fact, if we can get people before that, we can get more people doing the things that need to happen, and then we have less people that are suffering as a result.
Yeah, the healthcare systems, it's about illness, right? Physical, mental illness. So I appreciate that you're also bringing emotions and spirit and really health promotion into this. There was a question about how you create, or if there's best practices, or how to create safety in virtual group practice. But I'd actually ask that of both of you, because I think it also applies to groups as well, and relating to each other.
Yeah, it's a great question. It comes up a lot. It's actually the question that I get asked the most, is how do you make your space safe? I don't know that there's like a black and white answer to this. It's an intention. It's striving to create safe space by checking with people, and allow, helping people to be able to say things in a way that that they are comfortable. I personally do it through modeling. So we get sometimes somebody who comes to the circle who hasn't asked for advice or opinions and is getting advice and opinions. And so I can model a way to check with the person if that's okay or not, and sort of help to hold that space and demonstrate that there are ways we can have conversations that are kind and generative and supportive, even if we see things differently. That's how I've been doing it, and I am 100% open to learning even more about creating safe spaces, especially for young adults, which is an audience that I'm starting to move towards in terms of wanting to serve more directly.
And for me, so I mean, I have there's, I guess, two different kinds of groups that I run. So one are sort of the OHIP covered clinical groups, and for those spaces, I always meet with everybody individually first. So I already have a bit of a sense of what are the vulnerabilities of a person, what are the things that might come up, and then I also offer sort of like workshops that are not covered by OHIP, but are for people that like are interested in this work because they would find it useful in their organization or community or whatever it is. But either way, I mean, ultimately, I think when people are worried about a safe space, they're worried with emotions being evoked and then sort of people being left raw in a way that they don't know how to handle those emotions. And so I have had a lot of work with a lot of very unwell people. And the thing that I learned is that it's actually me trying to solve their emotions that puts them more at risk. And that if I leave enough space for them to move through their emotion, they will be safe at the end of it. And it's this counter. It doesn't feel intuitive to us because as a culture, we're very much trying to like not open up to some of the despair and hopelessness that we sometimes hear. And even as I hear it, sometimes I'm like, oh my goodness, where is this going? How is this going to wrap up? And yet, if I leave the space for it, and I allow, the other beauty of groups is that there are so many people that can empathize. And so the more people that can say, I get why you feel that way, it makes sense that you feel that way, that's where the healing actually is coming from. And it doesn't end up being unsafe as a result once I've done it that way. Now, that being said, I always have a check-in at the very end with everybody to see where people are at. And if anybody like were to say like that they feel unsafe for some reason, I could always make time for them if I needed to. I just find that actually I don't think it's ever been necessary at the end when I've allowed the process to go through.
I love that. The power of validating emotions. And that's often what we all need, no matter what we're going through. Absolutely. There's an Anishinaabe teaching that was shared with me by a friend of mine who says the emotions are like, crying is the rain. It washes things away, but then you also get life and growth through that. And that's what came to mind when you were speaking. It's raining right now where I am. There was a more technical question from Dr. Hadigan asking about whether if there's more in-depth questionnaires that you can go through to help understand eco-distress with the patients, and also with different interventions of support that you're giving in terms of being able to benchmark and sort of track your success.
Yeah, questionnaires is something that I have been trying to figure out what makes sense, because it's a relatively new kind of thing. Most of the questionnaires that I've found so far, people haven't necessarily rated that distressed on them in the first place. And so then how do you show any improvement? But like anecdotally, there's clearly a difference. I've only recently come about to a scale that was published in an article in October that I think actually will work a lot better. I haven't yet been using it with people. There was a period where I was trying to develop my own scale, but I'm not an expert in that, and it wasn't working that well either. So I'm open to suggestions about this. I do think I've finally come across the scale, but I haven't yet started to use it in a meaningful way. But I'm happy to also to connect afterwards if people have suggestions or want the. I don't remember the name of it off the top of my head, but I could give you that information if you're interested.
And I see someone posted about, the parks prescriptions. Absolutely. That's another area that's emerging is nature prescribing. And certainly we have a land-based healing, nature for healing program at our hospital that involves nature prescribing, which, if you're a healthcare practitioner, you can actually sign up with Nature RX and put in and you can actually prescribe through their service. That the idea there is that you get, they get a free pass to a national park, and in certain areas like in Vancouver, I think there's certain conservation areas they can go to, and I believe the Toronto Zoo now, and it's available in different provinces. But the idea of nature prescribing is a little bit less prescriptive than that. The idea is you have a conversation with whoever it is, a friend, a patient, someone you're in a relationship with, about what they think is what they can do, and then prescribe a dose and amount, and then you follow up. But I think the most important piece there is connection. It's about a mindful connection with nature. And we use sort of land-based healing principles with our Indigenous partners in this, things like putting your hands on the earth and feeling the earth, hug a tree, when you're outside or indoors with a plant or looking out the window, being intentional about what you're experiencing. And certainly there's a lot of evidence grounded in that. And this idea then, if you're cultivating relationships with nature, that helps people move towards wanting to protect and sustain that. So absolutely, nature prescribing is really powerful. And I posted as well, we have a nature challenge that we're doing with some of the organizations involved with this too, to try and get people to get out and share their connections with nature, share art with us, and there will be some sustainably minded practices, but again, to help promote this as a tool. So thank you for who posted that. Is there any final question before? Oh, go ahead. Sorry.
Yeah, if I also add, so I also actually hold my groups outdoors. Even as we head into the winter, I'm going to be holding them at least partially outdoors. And a part of that is also because sometimes people can feel embarrassed or like don't actually like want to connect with nature. But when I do that with them and do exercises with them in the group, then they see other people doing it too, and then they can actually allow themselves to open up to it, to then be able to do it beyond the group also. So yes, I think that's also a major important piece.
Perfect. Oh, and I saw tree stuffies. I love that. And something we have to think about indoor experiences as well when things like wildfire smoke roll in. Thank you to our panelists. That was incredible. I learned a lot. I actually feel better and a lot of hope. And I'm springing into the afternoon with a lot more energy now. So thank you very much to both of you for your time and your expertise and for the work you do. We need more of this. So I can't wait to hear more. And thank you for everybody who shared also their knowledge and wisdom in the chat as well. A lot of helpful resources for us to pore over. Have a wonderful afternoon. Oh, I see. Yes.
Thank you everyone for being here today. Thank you, Kady. Thank you, Nate. Thank you, Anna. We appreciate you being here. What a wonderful and lovely talk we had today. As I said earlier, I will be sending out the webinar recording to all the attendees and registrants. I will also be sure to send out the link for Kady's climate TikTok circle. And yeah, again, thank you all for being here today. Take care.